Hello, welcome. I'm Bruce Schechter, President Emeritus at the Intel Alumni Network, and welcome to this video interview brought to you by the Intel Alumni Network. We're trying something a little different today. As you know, over the past years, our focus of our events tends to be thought leadership, great historical reflections on Intel, and interesting topics about modern technology. Today, we're doing something different in that it's a peer into one of our fellow alumni in volunteerism, and timely and interestingly, it's volunteerism in the COVID response. Nancy Pressel, who we'll bring on board here momentarily, a wonderful friend of mine from my Intel days, she has been volunteering for the last 2 years with the Santa Clara County Department of Health COVID response. And Nancy, welcome. Maybe you could say hello to our audience.
Hi, everyone. Thank you for having me.
So let me just say a little bit about Nancy. Nancy has a master's degree in social work with a concentration on policy, administration, and community practice. Her areas of specialty include diversity and inclusion with an emphasis on social and economic justice. Now I know Nancy more so from our days together at Intel. Particularly, she worked in PR and then later media relations. And I remember my days being pulled into a room to talk to some press person with excellent guidance from Nancy. So I feel like it's role reversal now that she's the star of the show, and I'm enjoying that. By the way, before Intel, she worked in media relations, in TV news as a producer, which is a very interesting story. So Nancy, could you just tell us briefly a big picture view of what you volunteered to do over the last 2 years to set the groundwork for the discussion?
Sure. So I've done a number of things with the County of Santa Clara. I started off doing case investigation and contact tracing as a volunteer as part of the disaster service worker program. After that, I was asked to go work at the Mountain View Mass Vaccination Clinic. So my joke is I have a master's degree in social work, hand holding, and line management. And it was very joyful, so I'll say that. And then now I've started to do a little bit more of the resource coordination, because at its heart, case investigation and contact tracing really is about providing people resources.
Okay, good. And could you, what I recall from watching the news was there was a fair amount of discussion about contact tracing early on. And frankly, I just don't see it in the news much these days. But could you just define the term? And then with a little bit of discussion of what did they do here in Santa Clara County?
Sure. So contact tracing has been used in public health really since the 20s, starting with syphilis. It's still used today for AIDS, for TB, and other infectious diseases. So its purpose is to stop the chain of transmission of an infectious disease. And by doing that, it helps flatten the curve. And with something that's as contagious as COVID-19, it's not quite as effective as it can be with AIDS or with Ebola, for example, but it still has helped flatten the curve. So part of stopping the chain of transmission is to educate cases on how they can isolate safely, how they can keep their family safe, provide resources, because we cannot ask people to stay home from work if they don't have 2 days worth of food, or if they have first 2 weeks worth of food and now 5 to 10 days worth of food. And the other most interesting thing about case investigation and contact tracing is the data. I don't know if you remember, but malls were the last place to close and the first place to reopen. Why? The data. It's not a vector for transmission. And we know now why. High ceilings, good ventilation, people are moving, not stopping and sitting together for long periods of time.
So, okay, interesting. Nancy, when I think contact tracing, I picture like a mathematical graph of connections between who infected who and who might later have infected others. So when you collect information from one person, is there some attempt to contact other people who they've been in contact with? Does the government literally drive that?
Yes, yes. And we're not doing that so much anymore. At the beginning, it was so much more important than it is now because, I mean, it's incredibly infectious now. So a lot of us really feel like we're drowning, which is why we're moving to a resources model. But when I call someone, I ask them who their family members are, who their household members are. I ask them if they have spent more than 15 minutes, closer than 6 feet with other people and who those other people are. It is hard to elicit people's contacts because there's a huge mistrust among many populations for the government for telling on someone. And I have to say that I'm pretty good at getting people's contacts because contact tracing is about trust. It's about trust, it's about listening. We're asking people to voluntarily give up really sensitive information. So once I get people's contacts, I make a record for them. And then it goes over to the people who do contact tracing. We used to have a whole department doing that. And now the disaster service workers have gone back to their regular librarian jobs and accountant jobs and IT jobs. And so we don't really call contacts as much anymore.
So I'm curious, Nancy, like of all these, like, I mean, just what's your wild guess of all these calls you've had over the last couple of years? What, is it the vast majority who end up being pretty friendly to giving you the kind of information you need? Or like how many are just don't want to deal with it?
So I think it varies by CICT. I would say that for the very first time ever, 2 weeks ago, someone yelled at me. And he was really yelling, and it just so happened that my headsets weren't connected, so Don heard him. And he just kept, he said, "Who is this?" And I said, "I'm with the Santa Clara County Public Health Department." And he said, "I'm not asking who you're with, I'm asking your name." And it really rattled me. It really rattled me. And, I'm pretty good at being neutral. And eventually that guy just kept calling me. I kid you not. That guy must have called me a dozen times with questions after that. But it literally, for me, was the very first time anybody had been rude to me.
Well, that's encouraging. I mean, that it's
Mm-hmm.
better than I expected. Good.
Mm-hmm.
So how about just one more? You've largely already answered this question, but like, what does a call consist of? And like, how much time does it take? Just if you could encapsulate that in a pretty simple answer.
Sure. So the time in the call, it really varies. And a lot of it depends on how many times we call someone. We used to call someone 6 times. Now we call them once, they don't answer. That's that.
Oh, wow.
But it really can range from 5 minutes. Yesterday I had somebody who was very clear that they didn't want to talk, and they just kept saying, "Thank you for caring, thank you for caring," and they refused to interview. They just declined the interview. So that was a quick, 5-minute interview, make it 10 because I had to do the documentation, to 2 hours. My most memorable call, I would say, was probably 2.5 hours because an interpreter was involved. So it can just run the gamut.
Okay. And now I remember when we talked offline, you mentioned that the world, if I recall this correctly, the world is leaning more towards digital contact tracing. And I assume you're talking about like apps on our phones. And can you say a little bit about that and how it relates to
Sure.
what you do?
Sure. And I think that that's the model that we're all going to end up moving to, with at least with COVID. And CA Notify is an app that on the iPhone, it's under general, it's under the settings, and you just opt in for it. And for Android phones, it's an app that needs to be downloaded. I've downloaded mine. So say that Nancy and Bruce, let's not use our names, let's use Fred and Sally. Fred and Sally don't know each other. And we've both enabled CA Notify. And we're within 6 feet of each other for 15 minutes or more. Although these days, I have to say, 5 minutes does it. So our phones will exchange some anonymous keys by Bluetooth. And I think the keys change like every 15 minutes or something, but they change, often enough. And so once somebody tests positive, Sally tests positive, she both gets a call from her local health jurisdiction, in my case, Santa Clara County. And the verification code comes, and you can opt into understanding that you have been in close contact with someone and not know who it is. And it's funny, a lot of people like that, even with people who are their friends. They don't want to tell.
Do the administrators of this system have any way of knowing, I don't even know how to frame this, like, of all the people who've been informed, how often do they take some kind of action and quarantine or whatever? I'm guessing there's no way to really know.
There isn't a way to know, and it's even more complicated now with the home tests, because the public health department is supposed to be informed of infectious diseases, and so they're really, on most tests, you don't have to inform public health. Although I do speak with a lot of people who say, oh yeah, my kid came home from school, now I'm positive on a home test, my husband's positive, and I do make records for them then, but otherwise we wouldn't know.
Okay, got it. How about if we see if there's interesting stories about what you've experienced? Like, is there some particularly interesting, something that'll just be really memorable to you, maybe even preferably in a good way, like what's happened that gave you extra confidence in our response?
Yeah, I was funny. I was thinking last night, I have broken up Super Bowl parties. I have ruined people's Christmases. I've seen it, heard it all. I feel like, I've done it all. I've had interpreters get in arguments with the people I'm trying to interview. I've seen it all, but I can.
Nobel Prize.
It's sometimes I just think, wow, But I'll tell you probably the real most memorable case that I had. This was a 2.5-hour call, and it was 4:45 on a Friday, and I did work, over the weekend during that time, 4 days a week, about 10 hours a day. It was 4:45 on a Friday, and I said to Dawn, one more call. I tried them this morning. They didn't answer, and they're not going to answer now, and they did. And I would also say that in many ways, the story, it's a little bit long, but it does kind of encompass everything that, that a case investigator would do, which is what I did. So the story actually began way before I called. I called in February, but it started 3 days before Christmas. I spoke, so I had a Spanish interpreter named Fernando, who also had his most interesting story. We get the person on the phone who spoke Spanish, and he was a true interpreter. Sometimes people just translate, but he was a real interpreter. And so the story was, the first thing I heard was him crying. I don't know if I could tell this without crying. And then she was very softly crying throughout the entire interview. The man, her husband, who was at the time hospitalized, started having symptoms of COVID 3 days before Christmas. On Christmas Day, he was admitted, and he was hospitalized for 4 days, I think. When he got home, he experienced a pulmonary embolism due to his infection. And again, rushed back to the hospital, and he persevered. He went to rehab, and he had another pulmonary embolism. And at that time, he was intubated. And the next day, they told his wife that he wasn't going to make it. And he had his last rites over FaceTime, and they removed the life support, and he woke up and recognized his wife and fell into a coma.
Oh, wow.
And he was still breathing on his own. When I called, this family had nothing. So both the wife and her husband worked at a meat packing plant, vulnerable people, the people who handle our food. They had nothing. They didn't have toilet paper. They didn't have toothpaste. They were about to be evicted, even though, back then that wasn't allowed. They didn't know, they didn't have 2 days worth of food. They didn't know what they were going to do. And they didn't have a savings account anymore. Anyway, that was where it ended. Now, I never know what happens to someone after I speak with them. But this time I did, because after I got off the phone, the interpreter was pretty upset. So I stayed on the phone with him for a while. And I did, something that we're not supposed to do, but I gave him my WhatsApp contact information. This was Friday night. On Monday morning, he sent me photos of groceries all over their house, toilet paper, food. I mean, bags and bags of Safeway groceries. Their rent was paid for 2 months. Their cell phones were paid for 2 months, and their electricity, their utilities were paid for 2 months. I just thought, you know what? I work for a great county.
Nancy, is this happening because of the feedback you through the system, and then that goes back to the county? Is that how it happened? How did this happen?
Yes. So we have the ability to create referrals, and we have resource coordinators who work, and we also have clinicians. So if I'm worried about someone and they don't have a doctor, they can talk to a clinician if I put a referral in. And if someone doesn't have insurance, the county gets them insurance. I live almost soon, but I work in a great county.
Yeah, it sounds that way.
Yeah, Santa Clara County has been at the forefront of this, along with other Bay Area counties. I mean, if you think about, go ahead.
Yeah, well, sorry to interrupt, Nancy, but
No, it's okay.
Go out of my planned order just a little bit here. Like, do I recall that you said Santa Clara County and the surrounding, particularly San Francisco area, they've learned this whole response to a pandemic better because of their experience with AIDS? Is that a correct statement?
Yes, I would say so. And particularly during the 80s, when case investigation and contact tracing was so important in stopping the transmission of the AIDS, of HIV. And I think that one of the best things that came out of it is helping people trust government, because you have to really know how to develop trust, particularly with sexually transmitted diseases.
Right. Hey, I think you may have already answered this question, but like, what would be your, well, no, you haven't. Like, what would be the story of where you felt you've been able to be most helpful? Because I mean, I'm guessing, you just told one very difficult story in one regard, and you probably indirectly or directly heard of people who just didn't make it. But what about you, how you were able to help, and maybe even help save a life?
So I do think that I've saved several lives. I can't tell you how many times I have said, please hang up right now and call 911. Mm-hmm. But I don't know. I really, and it would be unethical to go back and look.
Right. Okay.
So, and I don't look at obituaries either. It doesn't feel right. So I know I've saved some lives. But I think one of the best things that I've done is that, I think we talked about this earlier. Information isn't just power, it's grounding. When I talk to people, sometimes they're just, they don't know what to do. They don't know what it means. They don't know, what do I look for? Am I going to get sicker? Am I going to get better? How long is my taste going to be gone? Will I ever be able to smell again? People are a little bit, emotionally out of control when I speak with them. And I think that having, a non-judgmental, neutral person to, help them through things. I'm not a doctor, but I can tell you, I've talked to thousands of cases. So when somebody asks me, am I going to get worse? I'll go, let's see, you're on day 5. I can say things based on my observations. No, you're not going to get worse, I don't think.
Hey, could we go back one moment to, we talked about people's willingness to engage in your conversation. Has that improved with time, or gotten worse with time, or maybe there's no effect?
I think it's improved with time. I think people are more trusting. And although I have to say, I've had more people hang up on me, and than I used to at the beginning. I think that people have an understanding now of what they're supposed to do. So I think it's been easier. And I think that it's been easier on me in many ways because as as people have become more educated and more knowledgeable, um, I don't have to spend a lot of time explaining things. I get to spend a lot of time making sure they're okay.
Right. Good. Would you say when you look back on this, will it, and it, I mean, clearly I'm reading that you feel like you're, you feel like you've done good for humanity, but was it fun in many regards?
So for me, yes. Um, Not everybody. I know a couple librarians who could not wait to get back to their regular jobs with the county. Um, for me, uh, it was, I would say, it was probably the most, it is the most rewarding work I've ever done in my life. And, it takes a certain personality. What are the things that I love? People fascinate me, and I explain things well. Something really that I learned at Intel, explaining technology to non-technical reporters. Um, and I like to talk. It's a perfect job for me.
That reminds me of you mentioned to me that you spent time. I'm not even sure I know exactly what this means, but you worked for a period of time in a mass vaccination clinic, and just say a few words about that.
Okay.
I think you
So
enjoyed that.
I loved that. I loved it so much, particularly because it was, we came out of a really dark period, and where I didn't know what was going to be at the other end of the phone. I didn't know if I was going to talk to someone who just told me that their father died. I didn't know if I was going to talk to someone in the parking lot of VMC saying that she thought her mother was up there dying at that moment. I just, so there always was this kind of holding my breath a little bit until someone answered the phone. And with vaccines, there was, really this ray of hope. And when they asked me to, go volunteer in Mountain View at the Rengstorff Community Center, I wanted to do it so bad, but I wasn't vaccinated yet. So I had to wait till I got vaccinated, and I was kind of low on the list because I'm not 65 yet. So I wasn't in the group that could get vaccinated right away. But nonetheless, I did manage to get vaccinated and go down there. It was by far the most joyful work I've ever done. People were happy and grateful to be standing in the heat of the day in a 2.5 hour long line and just be happy that they got to go get a vaccine. And then when kids came, that was just great because, kids were scared, and, we could give them the spot treatment if they were really that scared. And so, I got to calm people down, make sure people stayed away from each other until they were vaccinated. It was really fun. It was just so joyful. I loved it.
Okay. Now, do you have an opinion on the following? Like, I think many of us observe that people's behavior in general around society has been very preventative. Reasonable social distancing, masking where necessary, and therefore I believe there's some evidence that normal things like the flu are low this year, just because everybody's prevention behavior is pretty good. So the question is, do you personally have a prediction about, where are we going to, I mean, assuming, and God knows, but assuming COVID becomes containable, endemic, not serious, 2, 3, 5, 10 years from now, will we see people on airplanes with masks, or will people just in general be careful in a way that they weren't 5 years ago? What do you think?
So I have a feeling, and maybe kind of an observation just based on, chatting with people. Um, I do think that we're going to see masks way more often. Well, and we never really did in this country, but I do think we're going to see them more often. I can tell you that it will be a long time, if ever, before I get on public transportation, particularly a subway, without a mask. And I do think they're helpful. And I also think one of the other, I think, good things that I'm hoping will come out of this is that employers will not expect people to go into work when they're sick. And this kind of hybrid model of being able to work from home and go into the office when needed, I really hope that that is something that we see in the future.
Yeah, I would agree. You already mentioned earlier in our conversation that you felt like your experience at Intel helped with your clarity of communication. Is there anything else about your experience at Intel that helped you in this endeavor?
I do think so. I think that we use a lot of technology to do this, so I'm comfortable with technology. Not everybody, my age, feels as comfortable with technology as I do. I love technology, and thank you, Intel. I am the resident expert in our house, including Don,
Really?
who, oh yeah.
Oh, can you say
Yeah.
just few words about Don? I was going to ask you about this early on. I know it's normally not politically correct to ask somebody about their
That's
spouse,
okay.
but seeing as how he's a luminary from Intel as well.
You mean the love of my life? Okay, yes. So my husband is Don Alpert. He was the principal architect for Intel's first Pentium processor, and that's how we met. And who says that microprocessors can't be romantic? And I was actually asking him, what I want to make sure I get, your title correct and this and that, so what should I say? And he said, you can just tell them that I'm the love of your life. And and it's true. We're perfectly suited for each other. So yeah, Don Alpert is my sweetie.
So that's the best outcome of your time at Intel.
Yes.
Hey, okay, how about this? Do you have advice for anybody who maybe we get lucky and some people are inspired by watching this? Like, any advice on how they go? Maybe we're late in the game for COVID now, I hope, but what about other kinds of things, or any advice in general?
For contact tracing or volunteering?
Just volunteerism in general. You may not have a broad answer for this, but any thoughts would be welcome.
So one of the things that I've noticed about, being somebody who's, retired, I found it very difficult to find a place to volunteer that really utilized my skills. And particularly that also gave me the freedom that, that at this point in my life that I want. This really was the perfect opportunity. And, I know you asked me before, why did I do this? And while a lot of it was altruistic, I wanted to be, part of the solution to this. A lot of it was that I wanted my life back. But what I've really learned is that I do need to contribute in some way. I can't just walk to the gym every day, walk home, make a beautiful meal, plan travel. That being involved, I can say, as a volunteer is really, like I said, the most rewarding experience in my life. And I don't know what my next volunteer opportunity will be, but I can say for everyone, it's very rewarding.
So by the way, as usual, you're a little bit one step ahead of me on my questions, because you've already answered this to some degree, but is there any more to share about how this has affected you? Like, is your life going to be different somehow having been through this?
Yes. So it's sometimes it's hard for me to say this without crying. I will say again, the most humbling and rewarding work I've ever done. I started off wanting to be someone who helped with the change, who kind of helped kick COVID to the curb, except that I'm the one who's changed. I am changed. And, like you mentioned, I have a master's degree with a concentration in some fancy words, but it really was a concentration on social justice. So I was woke before the word existed. I was not woke. The fact that the people who take care of our food didn't have enough food to last 2 days, by and large. And I think I mentioned before, one of the things to you anyway, one of the things that we ask people is, where are you isolating? Is it a private home? Is it a dorm? Is it a hospital? And we do that to try to understand how the virus spreads. And, I talk to sick people, and some of the questions I feel are a little excessive. And so one of the things that I do, when I don't even ask that question, I just use Google Maps and use the Google Mobile to drive around and see, is this an apartment? Is it a private home? Where is this person? The number of times that I saw people living in permanent tents with a permanent address on the side, of a agricultural field, who didn't have 2 days worth of food. Sorry, that we just can't let that happen anymore. And what I might do after this, might have something to do with food security, because we can't do that. And the other thing that I would say is that being invited into people's homes so graciously all the time, I'm great. I'm overwhelmed, with gratitude.
Well, I'm overwhelmed with gratitude, Nancy, that you were willing to spend this time with us. That was just, for me, just absolutely fascinating, and I hope other people enjoy it as much as I did. So thank you. Thank you very much. I just have a few parting words I want to share with the audience. I mentioned early on that this is a little different than what we normally do here. And I'm an obsessive person when it comes to feedback. So and by the way, I think Nancy has told me offline, she's open to questions or feedback as well. And the best way to get to us, the easiest way probably would be to email us at info@intelalumni.org. So info@intelalumni.org. Many of you probably will see this video because you saw it posted to one of our social media channels. And if so, you're welcome to just leave comments or questions there. Let's see, or there's always carrier pigeon you could use to get to us. And by the way, in addition to giving us feedback about, did you like this, didn't, whatever, what we really love is, what would you like in future discussions? So, I've talked about, we've focused on thought leadership topics in the past, like IoT and machine learning and doing business in China and, running a vineyard. I mean, we've had a whole array of topics, but we want more of you. Any of you could potentially run one of these interviews. And I mean, we can't take all takers. We have some editorial control here, but we would love to have more suggestions, volunteers, whatever. So, email us at that email, or get to us any way you can. And finally, last words before we shut this off, huge thanks to Mike Trainer, who runs our IAN events program. Mike is here in the background doing all the real hard work while we, just sit back and chit chat. So thanks to Mike and the entire events team at IAN. So thank you, everyone, and we'll see you next time.
Thank you. Thanks, Bruce. Thanks, Mike.